breakdowns, fear, anxiety. These are the words 29-year-old Kanika uses when asked about how she's coping with the second wave of COVID 19. Both her parents are COVID positive, and her father has been in the hospital for days.
Personally, for me, it's been an emotional mayhem. In this second wave, my dad became a victim and a very serious one. And it just made me realize how crazy things are at the moment.
Kanika runs an online mental health platform, MindPeers, which connects people to therapists. And the statistics are enough to tell her that she is not alone. Apart from anxiety, depression, and grief that many are already experiencing, she says a lot of young people may end up suffering with PTSD or post traumatic stress disorder.
Last year, there were about 50 to 60 therapies that were coming in one day. And right now, from the last 3 to 4 weeks at least, that has touched 250 a day.
The second wave has been catastrophic. Images of people gasping for breath and collapsing in front of hospitals where no beds or oxygen are available have impacted the mental well being of many. Some experts are convinced this wave has triggered a mental health epidemic of its own. Therapist Shweta Srinivasan says many young people who come to her feel hopeless and anxious over an uncertain future.
We're all also collectively going through a traumatic space right now with the pandemic. Our bodies are responding with anxiety, with numbness, with overwhelm, and which means that none of us is prepared to handle an event as traumatic or as difficult as this on a global scale.
Srinivasan adds that being constantly connected with the world online and accessing new information, while helpful, is also impacting the country's youth.
By the second, we're getting updates from hospitals, cemeteries, crematoriums of these very, very triggering, very distressing images of people who are sick and dead and grieving families. And it's obviously affecting us.
I don't think it's an experience that any of us will ever recover from. Yes, we need help as we recover from this. Yes, we hopefully more and more people will seek help when it comes to their mental health. Uh, Hopefully, it'll increase conversations about it.
Both Arushi and Shayantan have been doing what they can to help by amplifying requests for emergency aid on social media. They say that while there is an overpowering feeling of helplessness, there is also some optimism in the way young people have been mobilizing help in these times. For Kanika, it is her work at MindPeers that has been helping her cope.
When I come back from the hospital in the evening, I'm just working because I know if I'm not going to distract myself, I'll just cry.
As she struggles to maintain a positive mindset, she is doing everything she can to bring her father back home soon.